As a physician, as a hospital leader, and as a CMO, I feel that my role is very much to be an advocate for patients and also to help with creating some order to what sometimes can be disorder within a hospital setting. We recently had a unfortunate young patient who had been very healthy and who suddenly died. They actually had come in extremis, and we did all we could, and despite that, the patient expired. We found ourselves in a situation where there was no brain activity. As you can imagine, this was a great shock to the family. As we found out more about her, we actually found that she had registered as an organ donor several years ago, and her family members did not know that. At that point, we realized that we were obligated to go ahead and see that her wishes were followed. But we also were in the difficult position of explaining this to a family that was going through an enormous amount of grief, shock. You can just imagine all the emotions that they were going through. When they heard that their loved one had registered as an organ donor, this also was a shock to them, and they had difficulty getting their head around that. We worked with our healthcare team, nurses that had cared for the patient, the physicians that had cared for the patient, the social workers, pastoral care. Behind the scenes, we actually worked with our legal staff to be certain that we were following both the letter of the law and the wishes of the patient, and at the same time really trying to offer all we could for respect and support for a family that was going through a good deal of grief. In the end, we did come to a successful conclusion. The family recognized that from discussions that this was a situation where their loved one did want this. And although some still had difficulty with understanding it, they at least understood that these were the wishes of their loved one, and that she could potentially, she would have experienced great joy if she had known all the people that she was helping as a result of becoming an organ and tissue donor. In the end, we went ahead and were able to successfully donate a number of organs, tissue, and eyes. Some of the family members came up and thanked us after this had all occurred, and I think even those that had a difficult time with it in retrospect are going to look back and smile and really be happy that they were able to move this ahead and follow through the wishes of their loved one. As CMO, I saw my role in helping steer everyone through this and coming to the successful conclusion that we did.